In a world where the air we breathe affects our lives more than we realize, millions are battling invisible forces that can make each breath a challenge. Allergies, asthma, and respiratory ailments are more common than we think, yet they're often misunderstood. Dr. Madeline Camejo, Chief Pharmacy Officer at Baptist Health, and Dr. Corey Frederick, Infectious Disease Coordinator at Baptist Health, are here to share their expert advice, as well as answer all your questions on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
I'm Kathy Buccio, and welcome to another episode of Ask the Doc, the show where we encourage our viewers to send in their health questions. We are waiting. So let's kick things off with a question from Paulette, who reached out to us through our website, allhealthtv.com. All right, Paulette's question is, hi, Dr. Camejo, I'm an allergist and ENT's dream patient because I have allergies and get sinus infections all year long. The ENT always used to prescribe a Z-Pak, but now I don't hear about it much anymore. What happened? Okay, we're kicking it off strong, Dr. Camejo. This is a great question. What is your answer for Paulette?
So, Kathy, you're absolutely right. It is a great question. And this is a question that is very topical at the moment. For those viewers who might not be unaware, but a Z-Pak is the brand name for an antibiotic prescription called zithromycin. Prescribing Z-Paks usually used to be extremely commonplace back in the 80s and 90s for wide varieties of infections. Like in previous episode, we kind of discussed the topic of antimicrobial resistance. And antimicrobial resistance is when bacteria develop tools to be unaffected by our current antibiotics. So we also will discuss how antibiotic stewardship programs play a pivotal role in promoting appropriate antibiotic prescribing. Now, one of the key principles of antibiotic stewardship is that not only prescribe antibiotics when it's actually necessary. So most times, organisms that cause acute respiratory infections are due to viruses found in our community. And when it comes to viral infections, antibiotics don't work and they're not needed. So you likely aren't going to be seeing many Z-Paks anymore, but perhaps because your diagnosis does not indicate that you might need one. So in the case of treating allergies, you definitely don't need any antibiotics for those. Those are only treated for over-the-counter drugs with antihistamines. So additionally, due to rising resistance rates in the community, Z-Paks is no longer the first-line treatment for bacterial respiratory infections. So anything more like a sinusitis, antibiotics like amoxicillin or Augmentin are now considered to be first line. And those are the ones that you need to be looking at first. So if you have any other questions about antibiotics, please ask your pharmacist or even talk to your physicians about it.
Thank you so much, Dr. Camejo. Now, heads up, we've got a YouTube question from Garth, and he wants to know, hey, Dr. C, I've been wheezing and coughing a lot lately, but it didn't feel like I had a cold, so I went to my PCP. He asked if I was experiencing any indigestion, and when I said yes, he suggested that I probably have acid reflux, which I guess can affect both the throat and the lungs. He prescribed something called a PCAB. Can you explain all of this to me? Thank you for sending in your question, Garth. Dr. C, I got to say, I'm a little confused too. That's a lot of letters. What does that mean?
So hi, Garth. I appreciate you reaching out. And this is actually a really important question. Potassium competitive acid blockers are a new class of drugs that inhibit gastric secretions in the stomach. Now, these can directly help people who are actually suffering from heartburn. So heartburn is that name that's kind of suggests like you're feeling a burning sensation near the heart, but it's not coming from the heart. It's actually a condition called acid reflux, where the stomach acid travels up back through the stomach, up through the esophagus, and up back to the back of the throat, which causes that irritation and burning sensation that most people feel. Now, I'm so glad to hear you went and spoke to your doctor about your coughing and wheezing. that you were experiencing, because sometimes heartburn can irritate the throat and can cause these exact symptoms. So essentially, heartburn can mimic the symptoms of a mild cold that just doesn't go away. But I'm optimistic that starting this new prescription can help you eliminate those symptoms and have you back on a road to recovery.
Thank you for that, Dr. Camejo. I did not realize the correlation or the difference. So thank you for clarifying that. Now we got another All Health TV question. I love it. Please keep sending them in. It's from Suzette, who asked, Dr. Frederick, I found out as a young child that I was allergic to penicillin. I had a negative reaction to it and almost died. I've heard of a medicine that I'm a little concerned about taking if I'm allergic to penicillin. Thoughts on this? Who
Kathy,
came up
that's
with the names of these medications? I'm not even going to say it, Dr. Frederick. So talk to me a little bit about what this means for Suzette.
Yeah, Kathy, that's a great question. There's a lot to digest when talking about penicillin allergies. There are all sorts of different allergic reactions that people can experience, and that influences what kind of antibiotics that they can tolerate. Some people have allergic reactions considered typically to be more mild, things like a rash or flushing or itching. But sometimes it can be a little bit more severe in some patients, something like wheezing or not being able to breathe properly or a huge whole body rash. Now, having a severe reaction is something that is important to distinguish, especially if it was life-threatening, like in your case. But just because you had an allergic reaction to penicillin does not mean you can't receive other beta-lactams. Now, what are beta-lactams? Well, beta-lactams are some of the most important and effective antibiotics that we have. In fact, most of our preferred first-line antibiotics are beta-lactams. Beta-lactams include antibiotics like penicillins and cephalosporins, which is what Ceftin or cefuroxime is. When it comes to beta-lactams, they all have slightly different chemical structures, so that means just because you are allergic to one may not mean you are allergic to another. Based on our evidence, if you had an allergic reaction to penicillin, you would not be expected to have a reaction to cefuroxime based on the chemical structure. However, it's important to state whatever medication allergies you may have whenever you are receiving medical care. And if you're concerned and want to learn more, you can make an appointment with an allergist that may be able to test for what exact allergies that you may have.
Thank you, Doctor. I appreciate that. Now, in case you missed it the first time, here's another opportunity to find out where to send in your questions. Dr. C and Dr. F are waiting. Here you go.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, another great question coming to us from Doting Dad Davis. Doctors, our delightful daughter Janine was recently diagnosed with asthma. I grew up with it and was constantly using an inhaler to clear my lungs. My wife and I would like to know what medications and treatment options are available these days. Great question. Now, Doc, is it possible to outgrow asthma?
Well, Kathy, it's different for everyone. Now, some people do outgrow it while others have to deal with it their whole lives. So, Davis, thanks for reaching out and with your question. But there are a variety of medications used to treat asthma currently. Additionally, there is no blanket treatment recommendations for all patients. Each patient will receive their own individualized treatments based on their own symptoms and asthma stage. Ultimately, there are reliever medications or longer-acting controller medications. So short-acting beta agonists like albuterol or an inhaled corticosteroid like bucinanide, inhalers provide direct, immediate relief when symptoms start by relaxing the airway muscles. Now, longer-acting medications like certain inhaled corticosteroids are very effective in reducing the inflammation that is usually associated with asthma. And these medications can include meds like Flovent or Pulmicort. Now, additionally, there are long-acting beta agonists similar in how they will work to albuterol, but they last over a longer period of time. Now, these can often be combined with an inhaled corticosteroid as a kind of a combination that can be extremely effective. Additionally, there are other medications for severe asthma or frequent flare-ups. Now, based on the severity of the patient's asthma, may indicate whether they need to use a rescue albuterol or a combination regimen. But again, each therapy is individualized to the patient.
Thank you, Dr. C. Dr. C, Dr. F, I actually have a question. Are allergies and asthma hereditary? So in the case of Davis, and because his daughter has it, is that something that she could have gotten because he had it? Is this something that we see?
So Corey, would you like to answer that question?
In terms of hereditary, that quite possibly could be. There's a lot of factors that can dictate, patients with asthma or any kind of like hyper-inflammatory response. It could be things in the environment. It can be genetic. So there are, multitude and a myriad of factors that can influence that.
Thank you, Corey. I appreciate that. Now we've got another YouTube question. This time it's from Tandy, and Tandy wants to know, Dr. Camejo, I've got another asthma-related question for you. Allergies run in my family, dust, pollen, pet dander, you name it, and we'll sneeze and cough because of it. I want to know if allergies can trigger asthma symptoms. If so, what are some prescription medications that can help with allergies since the over-the-counter stuff just isn't working? Great question. So can allergies lead to asthma?
Kathy, it absolutely can, but an allergic response can happen when the body recognizes something foreign, but otherwise relatively benign or not harmful that is threatening the body. So the immune system kind of works in a way that protects our body from harmful foreign pathogens, so it can start to attack otherwise unharmful substances and can go into overdrive, so to speak. So there's a lot of treatment that is going to be centered on decreasing the hyperactivity of the immune system and reducing the overreaction. Now, more mild types of reactions can be treated with over-the-counter antihistamines like a Zyrtec or an Allegra, but often for more moderate and severe types of allergies that induce asthma, prescription medications are then needed. And so there is a drug called Singulair that can definitely help. Singulair helps regulate that immune system so that it's not to overreact and to help treat both asthma and allergies as well. And you can also make an appointment with an allergist about receiving allergy shots. Allergy shots are also immunotherapy, can gradually reduce your immune system's response to whatever allergies you may be having that it triggers. So these shots occur gradually over time and require receiving regular shots and appointments with your doctor. Again, talk to your physician about multiple treatment options, or else you can also talk to your pharmacist.
Thank you so much, Dr. Camejo. Now, Dr. C, this next Facebook question is from Quentin, and he wants to know, good day, Dr. Frederick. My friend was recently diagnosed with what he calls walking pneumonia. Please tell me how that particular form of pneumonia is treated. So, Dr. Frederick, I've heard of walking pneumonia, but is it dangerous? Because it doesn't sound as dangerous as bacterial pneumonia, which that one has a higher fatality rate, correct?
Well, Kathy, there are different types of pneumonia, and they all necessitate different treatments based on those classifications. So let's dive into it a little bit. So let's talk about what pneumonia is right off the bat. So pneumonia is an infection of the lungs. In our lungs, we have these little sacs called alveoli, and those are responsible for gas exchange, basically taking in oxygen and giving off carbon dioxide. So you can imagine when these little alveoli become plugged with bacteria, that impairs gas exchange, and that can lead to the symptoms that we commonly see with pneumonia. So things like cough with or without mucus, difficulty breathing, fever, chest pain, and sometimes fatigue as well. So pneumonia is no joke. And if left untreated, pneumonia can cause hospitalization and lead to pretty severe complications. Now, it is true there are many different bugs and organisms that can cause pneumonia. This can also depend on where the patient got the pneumonia from. If it's a community-acquired pneumonia, that means the patient got the infection while either at home or somewhere in the community. And community-acquired pneumonia is most commonly caused by a bug called Streptococcus pneumoniae. Fortunately, we have a pneumococcal vaccine available, and that's why it's recommended for adults who are eligible to be vaccinated for the pneumococcal vaccine. Other common bacteria that can cause community-acquired pneumonia include things like Haemophilus influenzae or Moraxella. Now, like I mentioned, community-acquired pneumonia is mostly caused by bacteria. So unlike earlier where we're talking about acute respiratory infections, which are usually viral, pneumonia is usually bacterial, and antibiotics are needed when it's diagnosed. First-line antibiotics can include things like amoxicillin or doxycycline typically. Luckily, if you happen to be producing mucus or coughing up sputum, we can send that sputum to the lab to be cultured. And from culturing, the lab's able to tell us if any bacteria is present, and that would indicate what bacteria is actually causing pneumonia. So with that knowledge, we can be sure you're on the correct antibiotic to fully treat your pneumonia. Now, in your friend's case, they were diagnosed with walking pneumonia, which can sound kind of odd, right? So no, in this case, the pneumonia doesn't have legs and it doesn't walk around. But it is a type of pneumonia that is bacterial from within the community. Its main difference is it's caused by bugs that commonly don't cause normal community-acquired pneumonia, and so therefore they're not going to show up on a typical sputum culture or mucus culture. Luckily, we have effective treatment options for these walking types of pneumonia, including things like a Z-Pak, doxycycline, or Levaquin. Now, if somebody who's diagnosed with hospital-acquired pneumonia, that's a little bit different. That's a pneumonia that developed either in a recent hospital stay or in some other kind of healthcare facility. We won't get too in-depth really with that kind of pneumonia, but just be aware there are different types of bugs that cause hospital-acquired pneumonia. It's a lot broader, and sometimes those require hospitalization.
Thank you so much, Dr. F. Lots of information there. Thank you for unpacking that. Now, Dr. Camejo, we got another YouTube question. It's from Shoshana, who asks, Shalom, Dr. Camejo. I keep hearing about antibiotic resistance and superbugs. How dangerous are superbugs and how are they treated? Great question. I'm a little confused about it myself, so some clarity would be wonderful, Dr. Camejo.
So, Shoshana, I'm so glad you're asking this question about this because it's becoming a big problem with very serious complications. Implementations, especially in the future. But Dr. Frederick, since you're the ID specialist, I think this one's right up your alley to talk about.
Yeah, thank you, Dr. Camejo. Shoshana, this is a great question and can be confusing. I want to start by highlighting that antibiotic use in itself isn't necessarily something that's bad. The introduction of antibiotics for use in medical treatment has been nothing short of a public health miracle. We've been able to turn diseases that were previously life-threatening into something now otherwise relatively manageable. Now, some folks feel that their physicians may not be pushing antibiotics as hard as they used to, and I think this is where education on antimicrobial resistance has come into play. Antimicrobial stewardship programs have highlighted the effects of the overuse of antibiotics and the effects they've had on the development of antimicrobial resistance over the past several decades. So summarizing, the more we use antibiotics, the more we tend to lose them, not to mention the side effects and the cost that can come from filling antibiotic prescriptions. So instead, prescribers are becoming much more diligent on what indications are appropriate for prescribing antibiotics. Like we mentioned before, viral infections don't need antibiotics, so not prescribing antibiotics in those cases benefits everyone, and it's the right thing to do. Now, the term superbug, unfortunately, does not mean a superhero in this case. It's used to describe a microbe that has become resistant to a lot of our available antibiotics. When bugs become this resistant to available treatment options, they usually require hospitalization, IV therapy, and a consult to infectious disease clinicians to accurately treat. So superbugs are a consequence of repeated antibiotic use, whether the antibiotic use was appropriate or not. So again, another reason to only take antibiotics when they are absolutely needed.
Absolutely. Now, if you got questions, we've got answers. And just in case you missed it the first couple of times, here's yet another chance to find out where to send those questions. We're waiting.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
And welcome back. Okay, our next question is from Brady, who reached out to us on allhealthtv.com. You should really check the website when you get a chance. It is chock full of information that you will love and you will need eventually. So I promise you, take a look at that. Brady's question is, Dr. CNF, can you tell me if sinusitis, rhinitis, and the common cold, are they all treated the same? Great question, because when I get sick, I think I have everything. So let's break that down.
That sometimes can be. Let's talk about what the suffix itis means, and that might help clarify a few things. Itis refers to inflammation. So a sinusitis is an inflamed sinus cavity, pharyngitis is an inflamed pharynx, and so on. Now, there are differences between the three infections you just described, of sinusitis, rhinitis, and the common cold. Let's start by looking at sinusitis. Sinusitis, like I mentioned before, that's an inflammation of the sinus cavity. People with sinusitis often complain of facial pain or pressure kind of right here in this area, mucus and drainage from the nose, and headache, just to name a few symptoms. Now, about half the time, this is due to a bacterial infection, and the other half, it's due to a viral infection. So half the time your doctor will prescribe an antibiotic, while the other half, they may just recommend symptomatic care. So things like rest, hydration, taking over-the-counter meds for symptoms as needed for viral infections. Your doctor can typically distinguish between viral and bacterial causes of your sinusitis based on your presentation, and your pharmacist can help identify which over-the-counter meds would be best available based on your symptoms. Now, when we talk about rhinitis, that's just a big fancy word for a runny nose. As we all know, a runny nose can be a nuisance and a huge pain to deal with. Rhinitis can be a symptom of many different types of infections, including both sinusitis and the common cold. Now, one of the main differences between a common cold and a sinus infection are the symptoms. Typically, with a common cold, patients have a runny nose, fatigue, sore muscles, and a slight cough. With a sinusitis, people complain more of facial pain, and these symptoms typically tend to last a lot longer. And remember, with a common cold, that is always due to a viral cause, where sinusitis can sometimes be due to a bacterial cause. So if you're experiencing any of these symptoms, be sure to stop by your primary care doctor or local urgent care to meet with a healthcare professional who can accurately diagnose what you might have going on.
Dr. Frederick, I want to follow up on that quickly since you were talking about symptoms. And I think sometimes what happens, at least to me, is can you describe the difference between a common cold or an allergy? Especially when there's a seasonal change, because sometimes I'm like, am I taking a Claritin or am I taking a NyQuil? Where am I going?
That's a fantastic question, and a question that comes up very often. It's often very confusing because, like we just mentioned, a lot of those symptoms tend to overlap. One of the hallmark differences that sometimes is seen, again, not always, is a lot of time a common cold or any other type of infection like that, it's going to be associated more with a sore throat. But not always, because sometimes, especially in children, having allergies can also trigger a sore throat as well. So one of the things I would indicate is if it's a particular time of the year where you know you're expected to experience allergies, or you were in contact with something that you know you're allergic to, you can make a pretty good guess that it's likely allergies and maybe take an antihistamine. If you can't really determine what the etiology was or where it's coming from, well, in that case, it's maybe a good idea to follow up with a healthcare professional.
Extremely helpful. Thank you. Okay, so Dr. Camejo, we have another question. It's and this is coming from Andy. Hi, Dr. Camejo. My father Buck was having trouble breathing, and if you're asking if he was a smoker, the answer is a resounding yes. So of course he was diagnosed with COPD. Can you explain about the different treatments for this condition? Dr. Frederick, Dr. C, thoughts on that?
So Kathy, I think Andy has asked a very good question. You know, COPD is a chronic obstructive pulmonary disease, and it is diagnosed for a lung or airway disease. And that usually restricts breathing, commonly due to smoking. Now, folks with COPD have an airway inflammation and scarring that damages their air sacs in the lungs, making gas exchange more difficult. So COPD differs from asthma in that the inflammation seen in a COPD is really irreversible. And the management is based around prevention of the disease progression. And so there are numerous treatments options for patients diagnosed with COPD. First, there's a bronchodilator inhalers. They usually help relax the airway muscles, facilitating the flow of oxygen a bit easier. These bronchodilators can include things like albuterol, but which we've previously talked about with asthma, but also can include what they call a muscarinic antagonist like ibuprofen. Now, if COPD is more mild or acting, then bronchodilators are often prescribed, and these can work for about 4 to 6 hours after inhaled. For patients with more moderate or severe COPD, longer acting bronchodilators are usually given, and they're used more often. So now, on a COPD, exacerbation is defined as a sudden worsening of COPD-related symptoms, and that can last anywhere from a few hours to several days. And when you have those exacerbating, which actually occurs, then bronchodilators could be used in addition to corticosteroids. And corticosteroids are those anti-inflammatory medications that can help reduce that inflammation which occurs during exacerbation and can help relieve those symptoms. So if you have a severe hospitalization or you're giving what they call supplemental oxygen may be necessary, Additionally, if an exacerbation is expected due to an infection, an antibiotic may be prescribed. So patients with increased shortness of breath and increased mucus production with changing mucus colors are signs that that is an exacerbation. So this may be due to the infection. In that case, your doctor is going to have to prescribe an amoxicillin or a doxycycline to help you alleviate that exacerbation. But COPD is something that you need to take care of and be on top of, because it is a very hard disease to manage and maintain.
Thank you, Dr. C, Dr. F. Okay, we're wrapping up. The last minute thought in regards to allergies, asthma, and speaking to your pharmacist.
So Corey, I would say, I think we've talked about a lot on antibiotic resistance. So, make sure you only get prescribed when an antibiotic when you actually need it, and make sure that you all out there, we're in a line when you have those seasons that is cough and cold. Get your vaccines, get your flu vaccines, get all of that so that you're healthy throughout the year. That's what I would say. How about you, Corey?
So I would co-sign all that, absolutely. It's very important to not only, make sure that you take antibiotics when they're absolutely necessary, but also to, receive any vaccines that may be seasonal, things like influenza and COVID as well, to best protect yourself.
Thank you so much. That's all the time we have for today. I'm Kathy Buccio, and we'll see you next time on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.